Cancer is, again, not something that's going to go away overnight, if ever, but it's something that we really do have a lot of tools to address, a lot of tools to prevent. And if we can continue to get people to be screened appropriately, if we can get vaccination for certain types of cancers to be done appropriately, if we can just remind people of the steps they can take in their own lives to be prevented, we can make a huge difference. Even if we never eliminate everything, we know we can make it a better place for us all.
Cancer is just something that we all have to recognize, acknowledge, cope with, live with, struggle with, rage upon, crush, and even thrive with. This show is more than knowing and fighting or beating cancer. It's more than just relaying science, hope, and technology. Together, our purpose is to demystify cancer, take away as much fear out of the diagnosis, treatment, and process as we can, defeat its grip on our lives. This is The Cancering Show. We know that Alabama has big challenges when it comes to health, and cancer is no exception. With lung cancer, for instance, Alabama's survival rate is next to last among all the states. And you've heard me say that we are third in the nation for incidence and death in cervical cancer, a preventable disease. And of course, these are not just statistics, they are friends and family. So to discuss all of this, we wanted to go straight to the top to Dr. Scott Harris. Dr. Harris is our state health officer, and his career in public health spans nearly 3 decades. He graduated from Harding University in Arkansas and then attended medical school at the University of Alabama in Birmingham and completed an internal medicine residency at Caraway Methodist Medical Center in Birmingham. He then went back to UAB for a fellowship in infectious diseases and a master's in public health. So Dr. Harris has been our state health officer for many years and most recently was elected to become the next president of the Association for all state health officers in our states and territories. So he's now been put in charge of our health for the country. So we are so excited to have him today to talk about these health challenges in cancer in Alabama. Dr. Harris, welcome to the show.
Thank you so much. It's great to be with you.
So we were just talking about the fact that you were an infectious disease doctor by trade, now the head doctor for the state of Alabama. I think that it takes an infectious disease doctor to understand how to fight cancer in Alabama. What do you think?
I bring my own perspective. I think that is a good way to look at it. We know, some cancers, some really big cancers are literally caused by infections, and maybe not all of them are, but we still think of cancer as an epidemic, and we use a lot of the same tools and strategies when we're trying to combat it.
I think most important, really bringing together a lot of people from a lot of different entities within the state, and you've done such an amazing job with that.
Well, it's very kind of you to say. I would say I get to have my face on television sometimes and act like I can take credit for the work that a lot of other people are doing. We have a great department. The men and women in public health are really, truly public servants who do a great job with this work. They really are passionate about it and care about it. And also, I would say we've not been successful in anything that didn't involve a lot of collaboration with a lot of people who are outside of state government too. A lot of people in the medical community, a lot of nonprofits, a lot of other social service organizations. So many people are working together on the problems we face, including these problems around cancer. And, it's not one person or even one organization that's making a difference, it's everyone.
I think that's so true. And tell me, as you look at the whole state, kind of what cancer trends are troubling to you at the moment?
There are several things I think that get our attention. I think that one is that we're worried about some cancers presenting more late in the course of illness than we might have otherwise seen. And some of that is left over because of the pandemic interruptions in care. When COVID happened, there were a lot of elective things that got shut down. A lot of people weren't going and getting their, annual checkups. A lot of people who were taking care of their family and trying to figure out how to make a living weren't necessarily getting their colonoscopies and mammograms and pap smears because those things just took a back seat to everything else going on. And we know that those types of cancer screenings are really important. And when our population, is forced to take a couple of years off from cancer screening, I think we fear we're going to see more cancer from that. And the cancer that is detected, eventually as people get back into normal patterns is, very likely to be more advanced than it might have been, if we had been screening like we normally would. So that's certainly, one really big concern.
I will tell you, I definitely see that in my practice, that we are seeing patients who are sicker at diagnosis and later stage at diagnosis, to the point that it almost feels like it's altered our practice to some extent. There's so many more patients who are receiving chemotherapy for diseases that, if found earlier, would not have needed that. There's so many more patients who are not candidates for surgery that would have been candidates if the cancer had been found earlier. So really have noticed that to be practice altering. And we're almost just now coming out of it, that you can see us doing an increased number of those radical surgeries for early disease that we had not been doing.
Mhm. Oh, wow. That's amazing. I appreciate that first-hand account, but I guess in a way I'm not surprised to hear that. We certainly were worried that that would be the case. The other thing that we think about a lot in public health, and that we see now with respect to cancer too, is that there's just a lot of differences between who's at risk and who gets sick the most, and who's, more likely to pass away from cancer. And it's not always determined by the things that you think it would be. It certainly matters if you have health insurance. It matters if you have a doctor. It matters if you have medical centers in your community. But there are other factors that kind of predict how you're going to do even more strongly. And there are things like your zip code. Where do you live? We know that people who live in rural areas, for a lot of different reasons, sometimes have worse outcomes, or many times have worse outcomes than people in urban areas. And we know there's a big difference. What in public health we talk about disparities, or just differences in outcome. There's big differences in outcomes between people depending on their race. Black Alabamians and white Alabamians are not equal when it comes to rates of many cancers and survival for many cancers. So those are big, complicated problems. We could do a whole series of podcasts on that, I'm sure.
Absolutely.
But those are things that really get our attention.
Right. And how do we kind of tackle some of these issues? When I think about race and rurality in particular, we think of things like environmental justice and access, as well as, poverty and class. Are there state programs that really help patients to overcome these issues?
It's really complicated. And I would say, in short, there's not really efficient, well-working programs in state government that address that. We certainly try, we do our best, but we all have our own areas that we work in, and the lack of, for example, economic opportunity in the rural area, directly contributes to some of these things we're talking about. And yet, even though as a public health physician, I see that, I don't really have the tools to fix that, or to address that. There are other state agencies that do the best they can to go after those sorts of issues, but they're also not necessarily thinking about people with cancer, and so we all have our silos in a way. Is just one of the unfortunate ways that government works. We all have these different areas we work in, and so it's really hard to get a unified approach to go into a community and understand that, health and education and economic development, all these things are all really related, and they all, work in concert to, decide, the course of people's lives. How successful are they? How healthy do they stay? What are their opportunities? How far do they go in life? Those are really big issues and big questions, and it's kind of hard to address more than the little bit that's in your own little specialty area sometimes.
Yeah. Well, the few times that I have been out in the rural areas, I've been so impressed by the fact that the Alabama Department of Public Health is in these communities, and those health departments do exist. And you guys are bringing, the free breast and cervical cancer screening to these communities. I think we are just starting to learn how to use mobile units to increase that. The latest, and we're going to talk more about wipe out cancer, but the ability to bring colposcopy to these clinics for cervical cancer screening specifically, the newer grants that you're putting out for prostate and colorectal screening. I think there's some exciting things that are happening that are starting to make a difference.
I'm really glad to hear you say that. We in public health, a lot of times we feel like we're working in the dark over here, and people don't always notice what we're doing. But that's exactly what we're trying to do. We really see ourselves as the folks who are there to help people who many times don't have anywhere else to go.
Right.
We can't always provide the most expensive, latest high-tech treatment for everyone, but we can certainly make sure that people get the routine care that they need, and certainly routine cancer screening is just part of basic health care that all people deserve. And so we have, for many years, had the breast and cervical cancer screening program. We're very proud of that program that uses some federal money, but we're also very thankful that we get money from the state of Alabama to do that as well, and some other nonprofit money to do that as well. We can screen women in a certain income guideline. And if we find evidence by doing a colposcopy or doing a mammogram that they have cancer, they actually can immediately get enrolled into Medicaid. So based on that diagnosis, we would love for the word to be spread even more broadly about that. I've heard from patients who go, well, I don't have insurance anyway. I don't even want to get involved in all these tests. And is that going to cost me money? And what would happen if you found something? But we actually do have the way to connect people to insurance coverage through Medicaid and to medical care should they need it. And we do think it's making a difference. We have story after story that we hear from people who just really had nowhere else to go. And sometimes we find them at a really difficult place in their life. We find them that they're dealing with a cancer diagnosis they were unaware of. But, that's the first step in getting them the help they need. And that's really how we see our role.
Absolutely. And we can't talk about health departments in rural areas, not talk about vaccination. Before we go into that, tell us about Operation Wipeout.
Operation Wipeout is a strategic plan to try to eliminate cervical cancer in Alabama. Cervical cancer is something that we haven't done a great job of in our state. For a lot of different reasons, women in Alabama have a really high risk for cervical cancer, but even more than the risk of developing cervical cancer, they have a higher than average chance of not surviving cervical cancer. The rates of mortality, we say that the chances of dying from that diagnosis are higher for Alabama women. And it's just something that we ought to be able to prevent. Most cases of cervical cancer, most if not all cases, are probably literally preventable if we can reach people at the right stage of their lives and see that they're vaccinated, if we can see that they're screened adequately, or if they do have some type of abnormal finding, if we get them to care so they can get the appropriate treatment. We really have a vision that no woman in Alabama ought to ever die from cervical cancer. Maybe that's, impossible to imagine, but we imagine that. And so Operation Wipeout is a strategic plan that was put together by a number of folks here in Alabama. So we're just part of it. We're certainly not the only part of Operation Wipeout, but there are a number of other partners that we've worked with. And the strategies of the plan are to do those things that I just mentioned. It's to vaccinate people against a virus called HPV. A lot of Alabamians may not realize that most cervical cancer is caused by an infection. It's caused by a virus, and we have a vaccine that can prevent that. Many people just seem stunned when you educate them about that information. So we do provide those vaccinations in all of our county health departments. And then we do screenings. We do pap smears or specific tests for viruses. We can follow that up with colposcopy, which is like a microscope examination of the cervix to look for abnormalities, and we can get people to care if they need it. And by trying to put all of our resources into those programs, by educating the public, by educating other providers and recruiting them to help us, by putting out the word in places like schools about the vaccination that's available for kids, what we hope is that we can see this problem go away. It may realistically may never go away completely, but we're going to make a dent. I'll tell you, we're positive that we can make this better for women in Alabama.
Absolutely. Well, I want our listeners to know that there's a few things that are really unique about this. And y'all know that I sit in this field and kind of watch what's going on at a national level, sometimes participate in that. And I'll tell you, there's two things that are super unique about this, Dr. Harris. First, that we are the first state in the country to make such an announcement, and before the United States as a whole has made that announcement. So the WHO, the World Health Organization, has put out a goal for international elimination, which is a very broad goal. And Australia has put out an announcement for elimination that they expect to reach in 2032, which is not that far away as we sit here. But I think I wanted to point out how unique it is. So, of those few places in the world that are willing to shoot for this, Alabama is at the top of the list and has garnered a lot of national attention. But the other thing that is so unique about it is that it came from you. And I know you are correct. This is absolutely a partnership of so many organizations in the state. And USA Health is really proud to partner with you and with Wipeout. But I will tell you the fact that it came from the state health officer, not from a university, not from a politician, not from someone on, who kind of sits on a cancer committee, but it really came from the person who's in charge of the state's health, I think is why it's had such a big impact.
Well, thank you for saying that. I want to be really clear that I'm just representing a lot of great people in public health who are actually the people who had the idea. I'm really proud to be able to champion that. I'm proud to be able to represent that. Sometimes because of this job, I get to go meet important people who can help us with that and provide resources for that. But this wasn't my idea, so I just want to be really clear about that. But it was the idea of people who work in public health who just see the need out there, who really care about their community, who have the foresight to think about a future where we don't have to worry about this horrible disease. And there's just been a lot of great work done, and it's done with partners like you that you mentioned. We're working with other medical centers in the state. If I begin mentioning people, I'll leave people out, so I shouldn't. But I do want to mention in particularly Rotary International.
Absolutely. I was going to mention that. Yeah.
Yeah. They know a lot about vaccinations. If when I was a kid, polio was still a thing. And thanks to Rotary, polio is no longer a thing, at least in our part of the world. And they've been a great partner with us as well, and a number of other organizations. But, it's going to take all of us together, right? I mean, we're all going to have to work on this together. We're really happy to, provide the communications work and be the mouthpiece, if that's what you want to call it, and provide the facilities where people can come and get care in county health departments. But ultimately, it's all of us working together, and that's what it will take to get rid of this problem.
Absolutely. And I wanted to mention, the biggest thing in the news lately in this regard is the article that came out recently that looked at over a 60% reduction of death from cervical cancer in young women, which is attributable in this article to HPV vaccination. So I'm really hopeful that data will get people's attention and really turn the tide for maybe those folks who were reluctant or who were waiting to really see if it made a difference.
Yeah. It's really an amazing story. You can, if you think just only, a few years ago, how much like magic would it sound like if someone said, I can give you a shot and you'll never get cancer. I mean, that's a little oversimplification, but that's basically where we are. And I just wish we had more parents of young people to get that message and understand the importance of that. I would say to the folks who are listening here today, most cervical cancer is caused by this virus we've been talking about called HPV. Most of the time, not all the time, but many times that can be picked up through sex. And so what we want to do is make sure that kids are vaccinated when they get all of their other shots as a young person before they're old enough to be exposed to the virus. And that way, if they ever become exposed at any time in their life, really, then they'll be protected. And it's really that simple. The very best way we've learned to convince parents to vaccinate their kids is just to have their child's doctor or healthcare provider just strongly recommend it. And most parents who are taking their kids to for healthcare, they're going to listen to and take the advice of the person caring for their child. So we spend a lot of time not only just advertising to the public, but we spend a lot of time talking to pediatricians and primary care doctors and to others who are providing, care for children, and just want them to remember to emphasize the importance of it. I know it's sort of a weird place in America now where when we talk about vaccines and public health, people want to throw rocks at us sometimes, after going through the pandemic. So there's this vaccine skepticism thing that we've seen lately, and it's like, goodness, I never thought we'd be here. So it is hard sometimes for people to, be told, yeah, there's one more shot that we want your kid to get, and it's because of something that may theoretically happen later in life. But we know it works, and we know that that's the first and probably most important step in eliminating cervical cancer. So we know that's out there and it's possible.
Absolutely. And for our listeners, when we talk about that opportunity to get a vaccination and prevent cervical cancer, we're also talking about preventing head and neck cancer. That there is a cancer that is more common in men. In fact, HPV-related head and neck cancer in men is more common in the state of Alabama than cervical cancer in women. And so it prevents up to 7 different types of cancer, which I think is amazing. But in particular, we vaccinate boys to protect boys from a cancer that men get. So, 2 for 1, I think is a pretty good deal.
Yeah, and thanks for mentioning that too. Because HPV can cause cancers of the head and neck, and many times cancers in the mouth, in the oral cavity. We do work with dentists as well. We try to remind dentists of the importance of HPV vaccination, and they may not necessarily be giving those shots in the dental office, but we're educating them so that they remember to, again, talk to parents when they bring their kids into the dentist. We want them to also reinforce that message of the importance of getting vaccinated.
I think that is such a unique program to the state of Alabama. And I know a lot of work with Dr. Johnson as the state dental officer and things. So that's awesome. Can you tell our listeners, to go back to cancer in general, kind of what steps they can take to affect cancer maybe in their own lives as well as in their communities?
Yeah, that's a great question. We want everyone to remember that for all these potential things that can cause cancer, things out there in the environment and all these other types of things, there are a whole lot of cancers that you can really change your risk for just by your own behavior. Now, some of those are pretty obvious. I think most of us know smoking is a bad idea. If you're someone who smokes, please do everything you can to stop. There are a lot of reasons for that, but you will lower your risk for cancer. So many different types of cancers, not just lung cancer, but many other types of cancers as well. It's also true with alcohol use. Alcohol use, certainly excessive alcohol use. There's debate over what it means to be excessive, but excessive alcohol use is a risk for cancer. And so most people, probably would agree with you when you talk about the importance of smoking or alcohol in cancer. But they're just things like maintaining a healthy weight, eating nutritious foods. Those are, kind of common sense things we do for health, but they actually really can lower your risk for certain types of cancers. There are other types of infections, viruses out there that can also, in some cases, cause cancer too. Like the first one that comes to mind is hepatitis B virus. All kids now are offered a hepatitis B vaccine when they're young. It's a routine vaccine offered in childhood, but that really only started in about the mid 1990s. And so for anybody who's age 30 and up or 35 and up, you may not have that vaccination, and so that's a good conversation to talk to your healthcare provider about. Maybe you're eligible for Hep B vaccine. Hep B causes a lot of problems. There are a lot of reasons you wouldn't want to have it, but it also would reduce your risk for cancer if you were vaccinated against it. So those are all individual steps that we can take that are just our own behavior, the way we do things. And I've seen estimates that about more than 40% of cancers could potentially be wiped out if we just all did the right stuff, if we just all behaved the right way. So that's really important.
Yeah. And as an oncologist, I would just add to those that, Well, we've already talked about getting your screenings on time, kind of knowing what your recommended screenings are and getting those, or looking for ways to access those if you don't have insurance. And I would tell folks, to not let that impede you, to ask your doctor about opportunities for a payment plan, to ask if there are opportunities for screening. As I mentioned, the state offers free breast, cervical, prostate, and colorectal screening if you can help find that program. And I know we want to get people to where they could find out about those programs. Can you help us to let people know where those programs are? We can put that on our website.
Yeah, absolutely. We'll get that information to you for the website. But the simplest thing is to call your local county health department and start there. We also have the information on our own website, alabamapublichealth.gov, alabamapublichealth.gov. You can look for that there as well. But each of our county health departments have the ability to do cancer screening. Not necessarily every health department every day of the week, but certainly all of them at sometimes, and it's easy enough to schedule. But we'll also get that information to you as well. We really appreciate you getting the word out about that.
Absolutely. And the last thing I would say, and I say this to our patients, is one, know your family history. And two, if you are the person with cancer and you have a gene that puts your family members at risk, make sure your family members are aware that they potentially need to increase their screenings because of a risk. And for those of you listening, there are some mutations in some family histories that actually alter what your insurance will cover, meaning that they would be more willing to cover more intensive screening or even what we call risk-reducing surgery. So always important to know your family history and act on it.
Great. That's great advice.
Dr. Harris, anything else we should tell our listeners today about the work going on in Alabama or how to work together to reduce cancer?
I just really appreciate the chance to sort of shine a little spotlight on the work we're doing here. Thank you for asking us to talk about it. We're always ready to talk about it. And if listeners want us to come and talk about it, we have people in every county who would love to come to your church or to your school or to your workplace and let you know about the things that we're doing. Cancer is, again, not something that's going to go away overnight, if ever. But it's something that we really do have a lot of tools to address, a lot of tools to prevent. And if we can continue to get people to be screened appropriately, if we can get vaccination for certain types of cancers to be done appropriately, if we can just remind people of the steps they can take in their own lives to be prevented, we can make a huge difference. Even if we never eliminate everything, we know we can make it a better place for us all.
Absolutely. I think that is a great place to end. Thank you so much, Dr. Harris. We so appreciate you coming on the show.
Thank you very much for having me. I really enjoyed it.
Well, everyone, I am still a little starstruck. Dr. Harris is one of the most important health officers in the country these days, and I so appreciate his insights into what we can do as individuals and as communities, and of course, as a state to prevent cancer and ultimately to save more lives. I hope you enjoyed this conversation as much as I did. To learn more about Dr. Harris and his work, visit Alabama Department of Public Health website. And as always, keep cancering and take care of yourself. Thanks again for listening. And don't forget to submit your questions at www.cancering.com. We're here for all of those questions and we'll get you the answers. This show is brought to you by the University of South Alabama Mitchell Cancer Institute. MCI is a cutting-edge cancer research and patient center built to fight cancer smarter in Mobile and Baldwin County, Alabama. Our researchers and clinicians focus daily on the struggle against cancer, serving a potential catchment population of more than 4.1 million people. With a singular focus of advancing cancer diagnosis, treatment, and prevention throughout the Gulf Coast and beyond with science, technology, and hope. Want to know more about the Mitchell Cancer Institute? Visit us at usamci.com or search for us on Facebook, Twitter, and Instagram. Mitchell Cancer Institute is a member of USA Health. To learn more about all of our hospitals, clinics, and services, visit usahealthsystem.com.